Beginning March 17th, 5 more vaccination sites will open across Georgia, bringing the total number of state-run sites to 9. Right now, it's unclear which vaccine will be given at the new sites, but we do know Georgia is getting more than 83,000 doses of the new Johnson & Johnson COVID-19 vaccine this week. We've heard some concerns from a lot of you out there over the difference in the effective and just how effective this vaccine is. And officials are worried that the lower efficacy estimate will lead to a misconception out there that it's not as reliable. So joining me now is NBC News medical correspondent Dr. John Torres. Now we know all three provide, some protection against hospitalization, one, and deaths from COVID-19. So what does that efficacy rate actually mean and how is it calculated?
And Aisha, and that's where it gets kind of complicated, because when they do these trials, they look at the efficacy or the effectiveness. You can use those words basically interchangeably, how well it prevents something. And that something in this case was getting COVID disease itself. But the trials looked at it a little bit differently because the Pfizer Moderna looked at it over the spectrum of COVID. So anything from sniffles all the way to being hospitalized, whereas the Johnson & Johnson just looked at moderate to severe disease, and so they looked at a kind of a more fine-tuned process there, and that gave them different numbers. So when you compare the numbers, you have to be very, very careful, because you really can't compare that 72% Johnson & Johnson to the 94, 95% the Moderna and Pfizer. Instead, you have to kind of look at the overall disease process itself.
All right, yes, so many people are, really going back and forth about, if they're going to get it or not. So that's one thing we can't have out here is misconceptions, as another one is going to hit the market if we want people to be encouraged about getting vaccinated.
Exactly, and one of the main things to remember is, again, looking at that number, and people fixate on that 72 versus 95%, that's not the number you should be looking at, because they looked at those cases differently. When Johnson & Johnson were doing their human trials, it was later in the pandemic, there were more variants out there, and so people were getting sicker from the disease, and they were looking at people particularly that got moderate or severe COVID. They were not looking at people that got light or mild COVID. The other vaccines looked at that, and so that gives you a bit of a difference. But overall, Pfizer, Moderna, and Johnson & Johnson, they all looked at one common thing, and that was how well the vaccine protected you from hospitalizations and from dying from COVID. And all of them, regardless of who got what vaccine in the trials, none of them were hospitalized and none of them died from COVID once they were fully vaccinated. That's a great bottom line, Aisha. And
a lot of people, maybe you may be afraid of getting vaccinated for anything. And so this one is the one shot versus the two. So do you want to, gamble on which one you get, or just take the first one that's available to you?
No, Aisha, you want to get the first one that's available to you, because number one, you don't want to wait weeks or months to try and get a different one, because in that time period, you are at risk of getting COVID and the COVID complications. But on top of that, again, the bottom line, hospitalizations, deaths, dying from COVID, they all protect you from that. And at the end of the day, if you get a vaccine and you do get COVID and all you get are sniffles, that's a win.
All right, Dr. Torres, thank you so much. You can watch more tonight on Nightly News at 6:30. Thank you.